Hello again, everyone. Edwin Learnard back once again in this YouTube segment. I'm going to be giving you my coronavirus COVID-19 update for January 23rd, 2021. Now, first off is according to worldometers.info, as far as coronavirus cases, it was updated on January 23rd, 2021 at 2:36 p.m. GMT, according to the website. Coronavirus cases total globally are almost at 99 million. The deaths are about 2.1 million from the coronavirus COVID-19. The amount that have recovered is about 71 million. I'm not saying we're all oblivious to this or anything, but it's important to look at the recoveries. I mean, I know a lot of this is dire. We've had a lot of fatalities in this, but we've also had a lot of recoveries. I do think there is very bright light. I mean, there's light at the end of this tunnel. Right now, though, we do have, according to this website, there are nearly 26 million active cases. But when I'm looking at this, as far as the contrast between those that are in mild condition and those that are in serious or critical condition, the mild condition is it reads 25,565,227. Serious or critical, 111,256 people. 99.6% in mild condition and just 0.4% in serious or critical condition. Over 73 million closed cases. You have, according to this, though, it reads that the amount that are that have recovered and discharged were 97%, or 3% deaths. Now, the thing that I'm still, what's a little befuddling to me is when you look at, people talk about this recovery rate being at 99.6 to 0.7%, somewhere around there, which I'm seeing when it's contrasting the people currently in mild condition from the COVID-19 in contrast to the people that are in serious or critical condition. However, what I don't understand, though, is that when you have, then they show the total of the people that have recovered and discharged compared to the deaths, it reads 97% recovered and discharged and 3% that are as far as death goes. So I don't quite understand the disparity between the 99.6% in mild condition and then you have the 97% that have recovered. So anyway, I want to talk about next, as far as in the United States. We're going to look at this, and this is according to the New York Times.com. And let's see, it was updated 12:14 a.m. January 23rd, 2021, and that's Eastern Time. The other one, of course, was GMT for the worldometers.info. Now, according to the chart and graph they're showing, United States total reported cases to date. As far as I guess this is for January up till January 22nd. Anyway, 24.8 million. So we're approaching nearly 25 million total cases in the U.S. Almost about 192,000 cases on January 22nd. But on the positive end, as far as the 14-day change, it's minus 30%. Dr. Fauci had stated he believes this is, well, at least likely plateauing, and it does appear it may very well have plateaued, at least in the United States, because I don't know if we're going to be seeing any more of those 300,000 confirmed cases in a day or over that amount in a day anymore in the United States. I'm being hopeful and optimistic. I don't think that's going to happen. I think it's gradually on its way down. There is light at the end of this tunnel again. But the deaths were under 4,000, so that's a good sign. We don't want to have anybody dying from this, but at least there's a little improvement in this. Now, the deaths were about 3,700 on January 22nd, 2021 in the United States. It also reads about 116,000 hospitalized. So anyway, but the thing I want to get at is there's another thing too that I heard last night. I think it was on CNN. They were talking about, Dr. Sanjay Gupta was talking about something with the mask, um, and it was something like there's some masks that might be, as far as I guess you'd say the efficacy, the effectiveness of it, as far as the prevention of the spread of coronavirus or getting it, was like 95%. I don't know if that's actually, how much evidence they have on that, but yeah, you can confirm this on the internet. I do some searches on this and see if they actually do have the masks that are actually um, more effective, perhaps in terms of whether it's a spreading or contracting COVID-19. But of course, it is imperative to practice social distancing still and to be wearing masks during this time, because this is still prevalent, and even Joe Biden had stated this is going to get worse before it gets better. And I appreciate the fact that he's being what he believes to be very veracious, very truthful on this matter, and he's not just throwing something out there just to pacify and appease people. And I do respect him for that. Again, he does, as I've stated in some previous videos on this, that he does have that 100-day 100 vaccine, I guess it's 100 million vaccines and shots in 100 days, which seems plausible. It sounds realistic. A lot of people think that, or at least some people think that's not enough. But I would rather somebody set a more realistic goal and be able to attain it than put something too high and then the objective is not attained, and then people become more despondent about it and they become disenchanted. So I like the goal that he has set as far as the amount of those doses, vaccines, what have you, the shots in that 100-day period. I think that 100 days is a realistic period. I mean, you look at that, you're talking about like the end of April, um, early May maybe, when that time period concludes. Will be well out of the winter period, and you'll have a lot of shots that have been administered by this time. And I think at that point in time, we're going to see a pretty good improvement in this. Another thing I want to get at, as far as any news on this that's recent, I had Googled coronavirus, and then I clicked on news, and there's one result that comes up. It says 54 zip codes in New York City have positive coronavirus tests that are, and I'm trying to see this, I'm trying to see if it's over 10%. Yeah, over 10%. So we do, I mean, we still have, as Biden had stated, I mean, a lot of this, could be, this is going to probably be worse. It's going to be worse before it gets better. And according to the result on Fox News, it says, quote, Biden says nothing we can do to change pandemic trajectory in coming months, end quote. Well, we can do, I do believe we can do something. We can prevent it, to some degree, by taking the precautions, being prudent, wearing the mask, practice social distancing, not become complacent, be consistent in these practices as well. And this is something that we need to be very loyal and steadfast about, and not deviate from what we, from what actually is maybe starting to show a little improvement. If we start becoming relaxed, complacent, and say, well, yeah, we're going to be okay, nothing's going to happen, this is diminishing, that's when you get the fluctuation in these confirmed cases. You can get, some people might see, let's see a graph or something, and they say, oh, look, we're making significant progress. Look at the confirmed cases we had that day. It went down dramatically. Then what happens is people get relaxed, and they might not be wearing the mask as much frequently as they should, and then you have the spread of this stuff. So that's really what we have to look at this time, as far as the coronavirus and COVID-19 goes. And remember, we do have like these mutations and strains, and there was something in South Africa. I think Fauci had stated something like it's not those strain, it's not prevalent in the United States, but it has been in at least some states. You want to look, that's something you may want to confirm on the internet and confer as far as the details on that. So anyway, people, that'll conclude this YouTube segment. Until next time, people, Edwin Learnard saying stay well.